Welcome back. As promised, we're taking you live to Hobart now. This is where Anthony Albanese is speaking alongside Jeremy Rockcliffe.
Young rider here who had a fracture falling off a scooter just yesterday was here for an hour and a half. An hour and a half from the time that he walked in the door to the time he walked out with his mum, having his arm in a cast, having had the assessment, having had the x-ray, having had the setting and fixing up what would have been many, many hours in an emergency department, meaning more time in pain for young rider, but also meaning a backlog, which is precisely what urgent care clinics are designed to deal with. One of the things that the National Cabinet has been prioritising is ensuring that the primary healthcare system works to take pressure off our hospital networks. And there's nowhere we're working more closely with than here in Tasmania, where we've had pilot programs, where we have programs including the statewide SEM trial, which allows GP trainees to be centrally employed by the state through their training rotations. And that we announced with the Premier up in Devonport, I think it was, a little while ago, and that now is in place from July 2023. We're providing $20 million support for palliative care in Launceston. We've provided $135 million to Tasmania for these urgent care clinics, two of which are open, one in Launceston, one here. The second Hobart facility will be open shortly in 6 to 8 weeks, and we've identified a site as well in northwest Tasmania to deliver services there throughout the state. It's a part of the commitment that we have, the additional $358 million that we provided for the 58 urgent care clinics around the country, of which 22 have now already opened. The government also is investing some $3.5 billion over 5 years to address bulk billing. That incentive, which starts soon, a tripling of the bulk billing incentive will make an enormous difference, as has the cheaper medicines policy that came in on January 1. That's already made a difference of savings for Tasmanians of $3 million for more than 260,000 scripts that have been written here in Tasmania. $42.50 cost down to $30, making a difference for people, taking pressure off inflation, making an enormous difference. So I'm very pleased to be here with the Premier and with my federal parliamentary colleagues on what is an important day, and I do want to finish before I hand over to the Premier in giving a shout out to the doctors, the nurses and the health professionals here at this urgent care clinic for what they do to help their fellow Australians when they need help. We all would rather not see a doctor, I think, but when you need one in to deal with issues in an efficient way, and the urgent care clinics are doing exactly that, making an enormous difference here in Tasmania, but a difference that will be created right around the country.